My name is Amy Smith. I was diagnosed with breast cancer when I was 42 years old, about 4 years ago. I was diagnosed April 15th, and 4 days later I was on the table having a double mastectomy. I was stage 1B, grade 3, triple negative breast cancer. I was very aggressive. I chose a double mastectomy because I have a family history of breast cancer, and I just kind of didn't want to deal with it again. My own personal reasons. 4 days later, I was on the table having a double mastectomy with tissue expanders until I got done with 7 months of chemo and then had the exchange surgery. I still probably would have chosen the surgery that I had, but I didn't know all the options. And you have very limited time to educate yourself. You're on a very fast learning curve from the time you're diagnosed to the time you have to decide what surgery to have. So I wish I had known that there were other options. I was very scared at the time and said, take my breasts, I don't want reconstruction, I don't want anything, I never need them. And that was the fear talking. And thankfully I had a doctor that said to me, Amy, someday, I know you can't see it now, but someday you are gonna feel better and you will care. So thankfully he said that to me, and because now I do. I was on the mend after all of that, and my results, I had implants, I had exchange surgery and then implants, and I was not totally happy with my results once I started meeting other cancer survivors and seeing their results. I felt like things could be better. So I searched for another plastic surgeon to do a revision, and I found Dr. Thaxton. He came with great raving reviews, everyone I asked, and he did a revision. He fixed some scarring that I had, and then I had implants put back in, and I have been very happy with my results. I'm actually just about to have another revision of my breast reconstruction for rippling and dimpling, which happens because you have no tissue, natural breast tissue, between your skin and the implant. So, and I did not know that that was an option until I met someone who had had fat grafting, and they actually take fat from other parts of your body and insert it into your breast over the implant for a more natural feel and look. And I was elated because I didn't know. I called Melissa and said, do you do fat grafting? Because I didn't even know it existed. So I'm excited about that, just to restore a little bit of femininity back. And again, I just want women to know that they have options. You don't know that, and you don't have time to educate yourself. I think one thing that I didn't know going into having 4 days to think about my surgery, you get recommendations from the doctors, and that's great, but I didn't have enough time or even the knowledge to know that I had options. And so what Drs. Stewart and Thaxton are doing here with holding Breast Cancer Reconstruction Awareness Day, BRCA Day, is really great, I think, because we're letting women know that there are many options, not just implants, but all natural options, flaps and DIEP. There are lots of different surgeries that you can do, lumpectomies as well. So I think that you don't know what you don't know, and before you have cancer, it's not something that you study up on in case you get diagnosed someday, because you never think you're going to be the one that gets cancer. So you really are on a learning curve after that diagnosis, and you're scared, and you don't have a lot of time to make these decisions. There are many options for reconstruction. Stewart and Thaxton, Dr. Stewart and Thaxton can tell you all the options that are available, and that's what BRCA Day is, Breast Cancer Awareness Reconstruction Awareness Day here at Stewart and Thaxton, and it is to educate women about the options that they have, and there are many. And thankfully they do that, and we're very happy that they're here to educate the public.